If you or someone you love is dependent on alcohol, what follows is not scare tactics, it's a blunt medical truth. Stopping heavy drinking abruptly can trigger life-threatening complications. This video explains why quitting cold turkey at home is not just risky, it can be fatal, and why supervised, medically managed detox is the only safe first step on the path to recovery. Alcohol changes the brain and body over time. With prolonged heavy use, your nervous system adapts to the constant presence of alcohol. When alcohol is suddenly removed, that adapted system can rebound violently. Within hours to days, this rebound can produce symptoms ranging from shaking and anxiety to hallucinations, seizures, and a condition called delirium tremens, or DTs. DTs is not a dramatic phrase. It is a medical emergency. It can cause severe confusion, dangerously high blood pressure, fever, rapid heartbeat, and persistent hallucinations. Left untreated, DTs can lead to permanent brain damage, cardiac arrest, or death. Seizures are another terrifying consequence of abrupt withdrawal. These are not the occasional fainting spell. Alcohol withdrawal seizures can be generalized convulsions that strike without warning, risking head trauma, suffocation, or sudden death. They often occur within the first 48 hours after the last drink, but can appear later, and their timing is unpredictable. Emergency treatment is required to stop seizures and prevent recurrence. Trying to manage these events at home, alone, or with friends is extremely dangerous. Beyond the immediate threats, withdrawal is accompanied by intense psychological distress, panic, hallucinations, profound insomnia, and overwhelming cravings. These symptoms are themselves hazardous. Severely disoriented individuals may injure themselves, wander into dangerous situations, or make decisions that put their lives at risk. The combination of physical instability and impaired judgment makes unsupervised detox a recipe for disaster. This is why medically supervised detox is not optional for people with severe alcohol dependence. In a medical detox unit, care is continuous and interventions are immediate. Experienced clinicians monitor vital signs, neurological status, and hydration. Medications are used strategically to reduce the risk of seizures and to ease the severity of withdrawal symptoms. Intravenous fluids and electrolyte replacement correct dangerous imbalances. If hallucinations or severe agitation occur, staff are ready to intervene calmly and effectively. Most importantly, care is available 24/7 because withdrawal does not adhere to business hours. The difference between a home attempt and a medical detox is stark. At home, you are gambling with unpredictable symptoms and delayed emergency responses. In a medical unit, you have protocols, monitoring, and quick access to life-saving treatments. A medically supervised environment turns an acute crisis into a controlled, manageable process that preserves safety and dignity. It also sets the stage for the next step, a sustainable recovery plan tailored to each person's needs. Our 24/7 medical detox unit is designed precisely for this purpose. We provide continuous monitoring and evidence-based interventions in a setting that prioritizes comfort and safety. Our clinicians are trained to recognize early warning signs of DTs and seizures and to intervene before crisis escalates. We coordinate immediate medical care and begin developing an individualized treatment plan, because detox is the first step, not the finish line. When withdrawal is stabilized under professional care, patients are far more likely to engage successfully with ongoing therapy, medication-assisted treatment when appropriate, and support systems that reduce the risk of relapse. If you are considering quitting drinking, do not do it alone. If you or someone you care about drinks heavily and has tried to stop before, or has experienced shaking, blackouts, or confusion when cutting down, seek medical advice immediately. The stakes are too high for guesswork. Medical detox saves lives, protects the brain and body from irreversible harm, and opens the only safe gateway to true, lasting recovery.